Hello everyone, I'm Dr. Amit. So in our last video of the respiratory series, we talked about lung physiology and went into detail about lung volumes. So today we'll discuss about lung capacity, okay? So inspiratory capacity, functional residual capacity, vital capacity and total lung capacity. And at the end, we'll look at the summary diagram to put all it together. So before starting our lecture, please subscribe to my channel for more updates. So let's start with lung capacity. So let's talk about inspiratory capacity, okay? So inspiratory capacity is the maximum volume of air that you can breathe in after a normal or quiet exhale, okay? So it's written here that the maximum volume of air that can be inhaled after reaching the end of a normal or quiet expiration, okay? So what are the steps you can follow while performing in a patient? So ask the patient to exhale normally, okay? Now take the deepest breath possible until your lungs will be full. Now why this inspiratory capacity is important, okay? So doctor often use inspiratory capacity to see how much room a patient has to increase uh, their breathing during exercise or stress, okay? So because we see that in restrictive lung disease the inspiratory capacity decreases because the stretchiness of the lung has gone, okay? We can also find about the muscle strength, okay? So as in muscle weakness, if the muscle of the respiration get weakened, then like if diaphragm or muscles of the neck, that is accessory muscles, okay, become weak, then the inspiratory capacity will decrease, okay? So this is all about inspiratory capacity. So there is a formula of inspiratory capacity, uh, that is inspiratory reserve volume, that is IRV, plus tidal volume. So we all know the tidal volume is the air that moves into the lungs with each quiet inspiration, okay? And this IRV is air that can still be breathed in after a normal inspirations, okay? So if you add both these, then it will give the value of inspiratory capacity, okay? Now we'll talk about functional residual capacity, okay? So this is the volume of gas left in your lungs after you finish a normal exhale, okay? So volume of gas in lungs after normal expirations, okay? So the formula of functional residual capacity is residual volume plus expiratory reserve volume. It's around 2400 ml or 2.4 liter, okay? So for revision, we all know residual volume is air in lung after maximal expiration or exhalations, and expiratory reserve volume is air that can still be breathed out after normal expiration, okay? So this is the formula. Now why functional residual capacity is important? So it is important because this functional residual capacity, it act as a buffer or shock absorber for your blood gases. Second is this functional residual capacity, okay, this volume of air helps in continuous gas exchange, okay, because it stay in the lungs, okay? Now the third important thing is it prevent the lung from collapse because this volume keep the alveoli half inflated, okay? So it doesn't lead the lungs to collapse. Now the third important thing is dilute toxins, okay? So if you inhale a puff of a smoke, okay, suppose if you inhale a puff of a smoke or any chemicals, then that smoke or chemical get dilute in functional residual capacity, okay? So it doesn't hit your bloodstream at once, okay? So it also helps to dilute the toxins, okay? So that's why functional residual capacity is important. Now from clinical significance point of view, we'll see how it is what's its effect in emphysema, obesity or surgery or and anesthesia, okay? So in emphysema, the lung lose spring or the lung stay inflated, so the FRC get increased, okay? So the functional residual capacity increased and it causes hyperinflation of lung. In case of obesity or surgery, when we lie flat or some extra weight on chest, then in those conditions the functional residual capacity decreases, okay? Then it's very important, MCQ ask from this part also. So when we give general anesthesia to a patient, the functional residual capacity decreases. That's why the patient need extra oxygen or extra help for breathing during and after the procedure, okay? So this is all about functional residual capacity. Now the third one is vital capacity. Okay, so let's look at vital capacity. So vital capacity is the maximum volume of gas you can exhale after taking the deepest breath possible. Okay, so what are the steps you can ask to your patient? That inhale as deeply as possible. Okay, make your lung 100% full. Then exhale as hard as possible. Okay, so so the formula of vital capacity is inspiratory reserve volume plus tidal volume plus expiratory reserve volume. Okay, so we all know this inspiratory reserve volume is air that can still be breathed in after a normal inspirations. Okay, and this expiratory reserve volume is air that can still be breathed out after a normal expirations. Okay, and the tidal volume is air that can air that moves into lungs with each quiet inspirations. Okay, so the formula of this is IRV plus this tidal volume plus ERV. Okay, so why it is called vital? Okay, so because it tells us how much air is available for gas exchange during high demand. Okay, so it's written here that it tells us how much air is available for gas exchange during time of high demand. Okay, so now we'll talk about vital capacity in different points. Okay, suppose in case of height and gender. Okay, so taller people's and male have higher vital capacity. So in when you talk about positions, so vital capacity is more in a standing position. Okay, so now in case of restrictive lung disease, the vital capacity decreases. Why? Because the lung becomes more stiff and it doesn't expand. So in case of muscle weakness, like in case of myasthenia gravis or polio, the vital capacity of lungs get decreased. Okay, so this is all about vital capacity. Okay, now the last part is total lung capacity. Okay, so finally we have total lung capacity. So that is total lung capacity is simply we can define it as the total volume of gas present in the lungs after a maximum inspirations. Okay, when your lung is 100% full. Okay, so volume of gas present in lung after a maximal inspiration. Okay, so we can also say that point after your lung is 100% full. Okay, so what's the formula for total lung capacity? So inspiratory reserve volume. Okay, so what is inspiratory reserve volume? Air that can still be breathed in after normal inspirations. After then tidal volume, and that is air that moves into lungs with each quiet inspirations, right? And that after then expiratory reserve volume, that is air that can still be breathed out after normal expirations. And the last one is residual volume, that is air in lungs after maximal expiration. Okay, so we all know that IRV plus VT plus ERV is vital capacity plus reserve volume. You can also say that VC plus RV. Now why this TLC is important? Okay, so because in case of obstructive disease like emphysema, the TLC increases because the lung lose elastic CT and it become baggy or hyperinflated. Now in case of restrictive lung disease like scoliosis and fibrosis, this TLC decreases because of stiff lung. Now in case of athlete versus non-athletes, high TLC in athletes due to highly developed respiratory muscles. Okay, so this is all about total lung capacity. Now we'll understand this image. Okay, so this is tidal volume, that is air that moves into lungs with each quiet inspirations. Okay, so this is your tidal volume. Now this is your inspiratory reserve volume, that is air that can still be breathed in after normal inspiration. So this is the air. Okay, now we'll talk about this. Okay, expiratory reserve volume. So we all know that air that can still be breathed out after normal expiration. So this part is your ERV. Okay, now this is residual volume, means air in lungs after maximal expiration. Okay, so this much air left in the lungs. Now talking about the lung capacity, we all know this is total lung capacity. Okay, this is all is total lung capacity. This is vital capacity. Okay, adding the three. Okay, these three. Okay, and after then this is inspiratory capacity plus functional residual capacity is this much. Okay, so this is all about this figure. So I hope this video helps you understanding the lung capacity better. So please do subscribe and like my channel. Thank you.